definitely the DESTINY-Gastric04 study is a practice-changing trial because it's the first phase 3 trial with the trastuzumab deruxtecan in patients with HER2-positive gastric or G-junction cancer. Definitely, trastuzumab deruxtecan is currently approved in more than 65 countries based on the results of previous studies, the DESTINY-Gastric01 and the 2 studies. However, to definitively establish the second-line positioning of this drug, we needed phase 3 data in the second-line setting, and this is the reason why the DESTINY-Gastric04 study was designed to really compare trastuzumab deruxtecan with the category 1 option according to the all major guidelines, which is represented by paclitaxel and ramucirumab. And actually, the study showed the superior overall response rate, progression-free survival, and overall survival compared to the standard of care. So really establishing trastuzumab deruxtecan as the best second-line option in patients with HER2-positive disease following the failure of a standard first-line trastuzumab-based therapy. Gastric cancer is a highly aggressive disease, and patients face a high disease burden and burden of symptoms. And this disease is negatively impacting their quality of life and the limited life expectancy, you know. So definitely the gain in median overall survival is clinically meaningful for this disease. And we also had data on quality of life in the trial showing that the quality of life remained stable over the course of the treatment, and also regarding the safety profile of the agent with no new safety signals. So putting all together, we know that this is another option for our patients. It's already approved and reimbursed in several countries, but we really now can talk about continuous inhibition of HER2 across multiple treatment lines, from first line to second line. And so we have additional options to really extend the life expectancy of our patients with this disease. First of all, in the DG04 study, the incidence was about 13%, but only one patient had, in the experimental arm, had grade 3 interstitial lung disease. There were no grade 4 events, and especially no treatment-related deaths. So compared to previous trials, of course, we learned how to select patients for this therapy and also how to properly manage these side effects. So early monitoring, close monitoring, and also early intervention can prevent more severe interstitial lung disease and prevent, of course, potential toxic deaths, which were reported in earlier trials, even with a very low incidence. So definitely, even in clinical trials, we have really learned how to manage this potential side effect, and it's important to educate all the physicians for early recognition of this potential side effect of the drug in terms of patient selection. And so we really are not worried anymore about this potential toxicity, and we have learned over years on how to manage properly this potential toxicity. So it was not a concern in DG04 study. Good question. So when we have a drug with so promising and high activity, ranging from 40 to 50% response rate, of course, we want to move the use to the earlier lines and even to early stage disease. So basically, the DESTINY-Gastric03 study is still ongoing to evaluate the recommended doses of T-DXd in combination with chemotherapy or immunotherapy or both. So basically now we have the optimized doses of regimens, T-DXd containing regimens with fluoropyrimidines and immunotherapy. So basically, there are several phase 3 studies ongoing in the first-line setting, the DGO5 study and the DESTINY-Gastric04 study. Both trials are evaluating T-DXd in the first line to replace the use of trastuzumab plus chemotherapy and really to move forward with the drug development of this agent. But there are also ongoing trials in early stage disease. For example, there are proof of concept trials with the neoadjuvant use of T-DXd inoperable gastric cancer, HER2 positive gastric cancer, and there are also a couple of trials, academic trials, evaluating the role of postoperative T-DXd with liquid biopsy guided design. So basically, patients with minimal residual disease after standard of care therapy, including neoadjuvant chemo plus surgery, may really benefit from the use of T-DXd in the postoperative phase. And this is a liquid biopsy guided design and proof of concept for future development. Of course, when we have such an active agent, we want to move to the first-line setting for metastatic disease, but also to the earlier stage to cure more people. And this is exactly what's going on with the development of this agent. It was a great ASCO 2025 for GI oncology, so for colorectal, gastric, a lot of data. This DGO4 study was published in the New England Journal of Medicine, so read the publication, and there are a lot of data to follow. Thank you.